Hi, I'm Kimberly Calderbank for Community Cultures, and today we're with the Halton Paramedics. Did you know they respond to more than 55,000 calls in the Halton region each year? Chief Greg Sage has been with the service here, the Halton Paramedics, since 2000. Chief, what inspired you to start a career with the paramedics?
I actually started as a volunteer paramedic in Georgetown in 1988 and really was just interested in helping people and giving back to my community. And after volunteering for a year, I knew that this was the profession for me and ended up going to school and started working full time. And here I am all these years later.
All these years later. Now, let's talk about the community that you do support. Do you have any indication on how many calls the paramedics are receiving each day?
We do. So we do about 150 calls per day, 50,000 responses per year.
Wow.
We do that from 15 stations that are located all throughout Halton region. We have about 265 paramedics in the division, and then there's about another 35 support staff, so supervisors, admin staff, schedulers, logistics, folks behind the scenes that enable the paramedics to do the great things they do.
So we've been standing in the facility here and we've seen some buses go in and out, and I was actually surprised by that. And what I didn't realize is that if you're stationed at one station, you're not necessarily returning there. Can you speak to that?
Yeah, so the ambulances are deployed all throughout Halton region. They do start at one station in whatever community they're assigned to, but they will move throughout the day. So it wouldn't be unusual for an ambulance in Milton to do a call, end up at the hospital, perhaps do a transfer from the Milton Hospital down to Oakville, and then they could be sent to cover a station in Oakville for a period of time. We do move all day. They're very busy. They move all throughout the shift. And the other thing that is unique to paramedic services in Ontario is the system is seamless. So we also do calls outside of Halton region. Wherever you are in the province, the closest ambulance will respond regardless of borders. We do calls in Hamilton. Hamilton does calls in Burlington, likewise with PLM with Wellington County.
So through COVID, we heard the term Code Zero thrown around quite a bit in that there was nobody available to cover calls. What does that look like in the Halton region?
We do have periods where we have limited resources available. It typically happens when we get a large influx of calls in a very, very brief period of time. For the most part, that doesn't happen very frequently here in Halton region, as we see in some other jurisdictions. It does happen on occasion, but when we get into those periods where we do have limited resources, we focus on high priority calls. So patients that have minor ailments or injuries may wait longer during those periods, but there's always resources available to respond to high priority
and it's a process
calls.
of triaging
Absolutely.
as well, correct?
So our colleagues at the Ministry of Health Communications Center have a very, very comprehensive triage tool. It's been medically validated. They triage every call, assign a priority to it, and make sure that ambulances get sent to the sickest patient first.
Heather is a community paramedic here with the Halton region. Heather, can you explain to us the difference between a community paramedic and a paramedic?
Absolutely. So our program started about 2.5 years ago. We're funded by the Ministry of Long-Term Care, and the emphasis on our program is to prevent 911 calls. So what we do is we are not in an ambulance. There's 10 of us who are assigned to this program full-time. We're available 24 hours, 7 days a week for our clients. We drive a nice little truck. And what we do is we do routine visits to people's homes, and we deal with everything from dementia and Alzheimer's issues to urinalysis. So we can do a urinalysis in the home. We can get antibiotics for patients. We have a physician who we work with, and we can get blood work done. So we're trying to prevent the 911 call in the first place. If we can do that, we can cut down on our 911 call system and our overloaded hospitals. So the whole purpose is to take care of our clients who are awaiting long-term care. And the unfortunate reality is that the long-term care waiting list is well over 60,000 names right now.
Yeah.
And most people would prefer to be at home. So that's what our whole role is. We're just trying to keep people at home and do it safely.
So, but this is a program that you're probably signed up for or that you're already a part of. This is not something that would be dispatched, or is it?
It's actually our clients who dispatch us. So they'll give us a call if they're in trouble, if they need help, if they're not sure about something, they're just feeling unwell.
Okay.
A lot of the issues that came up with us at the very beginning was access to health care because of COVID. And a lot of our patients and our clients, they're isolated. They can't even get out of the house. So our whole role was to bring the hospital into the home, and that's what we do.
And how would somebody become a patient or a client, perhaps, of this program?
The great part of our program is that a lot of our clients are given to us by our 911 paramedics. So if, let's say Jason, if he sees a patient who's struggling at home and is in need of PSW care or medical care, he could refer us to, or that client to our program, and we'll go and visit that home and look at what we can do to offset the emergencies that could potentially happen.
Jason is a paramedic with the Halton Paramedics here. Jason, thank you for joining us today. We're standing outside of an ambulance right now, and one of the things that you hear often is they're coming to you sometimes in your time of need, or maybe in not your best day. Can be scary, can be overwhelming. What will we find inside in an ambulance? What would that ride look like?
Well, in the back of our ambulance, we have our stretcher. We also carry our cardiac monitor. We also carry a lot of our medications back there. We also have a trauma bag. We have equipment for delivering babies if need be, numerous different bandages, everything that we need to work in that emergency care setting.
And the plan is to be able to stabilize folks enough in community to transfer them to a hospital, is that?
Correct, yeah. There's different situations that we come across every day. Some people just require a simple transport to the hospital, see a physician. Some people require IV fluids or different medications. It varies from patient to patient, but ideally, yeah, we like to stabilize these patients and take them to the hospital for further treatment, yeah.
What does education look like to become a paramedic?
To become a paramedic, you have to complete a 2-year college diploma, and that consists of in-class training, that's scenarios and skills. It also includes about a 450-hour placement, actually alongside a paramedic in a paramedic service, getting kind of hands-on experience. Once you complete the paramedic program, then you're eligible for the Ministry of Health certificate, and that allows you to work in the province of Ontario as a paramedic.
Okay.
And then once you're successful in all that, then you can apply to become a paramedic.
Joining me now is Elizabeth. Elizabeth is a community member here in the Halton region. Elizabeth, how has the paramedics of Halton positively impacted your life?
I used to have some really ugly falls, so every other week they would be taking me to the hospital, even though I refused, I hated it. And we became, that they knew me, I knew them. So we respected and liked each other, and then trusted each other.
That's exactly what I was going to say. It's that trust, and we are so fortunate to live in a community that's small enough to really get to know each other. And I've been learning along my journey with this show that the more you're involved in community and the more you get to know your community, the more like home it becomes, really. So that care that you received during your falls was provided by the paramedics. What type of people were coming to care and help for you?
Lovely human beings.
Yeah.
Okay, and they didn't see me as just as a black woman or as a woman, but as a person and as a human being. And they knew all my quirks. They knew I hated going to emergency, but they would try to convince me. So it was, at the point, it was at the beginning like a struggle between the two groups, but then we learned to understand and to trust. And for me, the trust is very important. And then afterwards, with Dawn Marie, through that program, say I was in the hospital 9 weeks recently, and we had a big fight with about a special mattress that I needed, a gel mattress, and she was, I think, one of my strongest advocates. And everybody was so helpful, because I think once you go through and you pass the barrier, you realize that we're all human beings and we need each other.
Debbie is joining us today from the Ministry of Health. And Debbie, I'm trying to piece together how you belong to the Halton Paramedics story. Can you do the tie-in for us?
Well, I work for Ambulance Communication Center in Mississauga. So when somebody in Halton calls 911, they will be sent to a regional priority answering service, which is generally Halton Police Service. And they will ask 911, do you require police, fire, or ambulance? When somebody in the community says they require medical assistance, they are sent over to us, which is the Central Ambulance Communication Center. From there, one of our highly trained call takers starts gathering information from that person, what the location is, their phone number, what the emergency is. From there, they start to gather all that information. It's sent over to one of our dispatchers, who then starts to look for a resource, an available ambulance in the community close by that can be sent to help.
Yeah.
And while we're on the phone, while the ambulance is on the way, we're still gathering more information. We're making sure the safety of the paramedics is not going to be a problem. We're making sure the paramedics know what equipment they're going to need. Sometimes we will coordinate with other services, fire or police, if they're required to the call, and we get help to the person in need.
Transporting more than 35,000 patients a year, the Halton Paramedics truly are caregiving for our community here in the Halton region. For Community Cultures, I'm Kimberly Calderbank.